Hello, scientifically curious humans, and welcome back to the show that takes the questions everyone is whispering in dermatology waiting rooms and answers them with the biological honesty they actually deserve. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has been asked about salmon DNA more times in the past 18 months than she ever anticipated when she chose this profession. Dr. Lazuk is not with us today because she is currently at a regenerative medicine symposium in Seoul, South Korea, having accepted an invitation to present on what she described as the accurate placement of polynucleotides within a longevity strategy with particular attention to what they cannot do. She delivered her presentation. Attendees are describing the response as the most useful calibration this field has received since PDRN entered mainstream aesthetic conversation. She has since agreed to review 3 unpublished studies on injectable versus topical polynucleotide outcomes, co-author a position paper on regenerative signaling tools in combination protocols, and apparently redesign an entire panel session that she felt was treating biological messengers like volumizers and wondering why expectations weren't being met. She has been given full editorial control. The panel is now considerably more accurate. We have sent a return flight. She has acknowledged it warmly and done nothing about it whatsoever. So, you have the avatar, and today we are answering the question that has been arriving in Dr. Lazuk's inbox, her consultation room, and her general proximity with increasing frequency. Is salmon DNA really the future? The name alone creates a reaction. It sounds either like a genuine breakthrough or an exceptionally well-marketed gimmick. The truth, as it almost always is, sits quietly in the middle. Polynucleotides, often marketed as PDRN, are fragments of DNA, most commonly derived from salmon, because salmon DNA is structurally compatible with human tissue and can be purified safely. That compatibility is what gave the ingredient its early medical credibility, but here is what matters more than the fish. These fragments act as biological messengers, not fillers, not hydrators in the traditional sense, not surface plumpers, messengers. When tissue is stressed, injured, inflamed, or depleted, certain signaling pathways activate to initiate repair. PDRN works by interacting with those pathways, particularly ones involved in fibroblast activity, microcirculation, and tissue regeneration. In simpler terms, it encourages the skin to behave as though it needs to repair. That is why dermatology is taking it seriously. It does not sit in the cosmetic hydration category. It sits considerably closer to regenerative medicine. Now here is where confusion begins, and where the Instagram version of this story diverges from the biological one. There are injectable polynucleotides, and there are topical products containing PDRN or phyto-PDRN derivatives. These are not the same experience, not even close. Injectable PDRN delivers signaling fragments directly into the dermal layer, bypassing the barrier entirely. It can stimulate collagen production, improve skin elasticity, and enhance tissue hydration at a deeper structural level. In regenerative clinics, it is used for under-eye creepiness, acne scar support, post-laser recovery, and skin that looks thin or fatigued despite other interventions. It improves tissue quality, and tissue quality changes how everything else behaves. Healthier tissue integrates filler better, heals from laser more predictably, reflects light differently. That is the real value, not spectacle, but behavioral improvement at the tissue level. Topical PDRN is a different category entirely. The skin barrier is selective. Large DNA fragments cannot simply pass through the intact stratum corneum. Topical versions rely on smaller derivatives or delivery systems that interact with upper layers of the skin. Their benefit tends toward hydration support, soothing, and mild regenerative encouragement, rather than deep structural remodeling. Both have value, but they do not produce identical outcomes, and the social media narrative blurs this line, sometimes intentionally, in ways that create very predictable disappointment. A serum labeled salmon DNA is not an injectable in a bottle. It can support, it can soothe, it can signal gently, it cannot reconstruct. Someone who uses a high-end PDRN serum expecting the lifting effect they saw in a clinic demonstration video is comparing two genuinely different biological interventions. When the serum does not deliver the clinic result, the conclusion becomes it does not work. It works, just not in the way the algorithm promised. Here is the distinction Dr. Lazuk considers most important in this entire conversation. Hyaluronic acid holds water. PDRN influences behavior. But influencing behavior is not the same as rebuilding architecture, and that distinction determines whether this tool belongs in your strategy and where. So where does PDRN actually fit? It fits beautifully as a regenerative signaling tool that enhances the environment in which other treatments operate, the patient whose skin looks thin and fatigued despite other interventions, the under eye area that looks creepy even with careful filler placement, the skin that healed from acne but never fully regained elasticity, the barrier that is fragile and reactive after repeated treatments. The person investing in lasers or collagen stimulation who wants the tissue environment to be as receptive as possible. In those situations, polynucleotides shine. They improve behavior. They encourage repair signaling. They support microcirculation. They create a healthier terrain for everything else to work in. What they will not dramatically transform is the patient with significant volume loss expecting visible lift, the patient with moderate to advanced laxity, the patient wanting contour change or hoping to replace structural intervention entirely. PDRN does not build bone. It does not replace volume. It does not reposition ligaments. It improves the terrain. And improved terrain makes every other intervention more effective. There are also two specific places where PDRN is currently being oversold, and Dr. Lazuk wants to name them directly. The phrase DNA repair gets used loosely in marketing. True DNA repair is a complex intracellular process involving mechanisms far beyond what a cosmetic injectable or serum can directly perform. PDRN supports regenerative signaling. It does not rewrite genetic code or reverse chronological aging. It is a supportive regenerative tool, not a biological reset button. And calling it better than filler is like saying hydration is better than protein. They serve entirely different functions. Comparing them as though they compete reveals a fundamental misunderstanding of what each one does. Here is the philosophical layer that matters most. The direction aesthetic medicine is moving in 2026 is away from make it bigger, make it tighter, make it shinier, and toward make it healthier. Polynucleotides fit that future genuinely well, not because they are the most dramatic tool available, but because they are among the most intelligent. They are behavioral, they are longevity supportive, they are environmental stabilizers that make everything placed beside them perform better, but only when placed in their lane. The question is never, is this ingredient magic? The question is, what does my skin actually need right now? If the answer is behavioral improvement and tissue quality, polynucleotides may be a powerful and well-placed ally. If the answer is structural reconstruction, we reach for different tools. That distinction is the difference between chasing trends and building longevity. Quiet elevation is the theme, not spectacle, not salmon headlines, just smarter sequencing, with tools that actually match the problem being solved. Before we close, everything you just heard is purely for entertainment and educational purposes only, and does not constitute medical advice, a treatment recommendation, or a clinical assessment of your individual skin or tissue concerns. Injectable treatments of any kind require evaluation by a qualified physician before any decision is made. For more information and tools to better understand your skin, visit SkinDoctor.ai. And if this episode finally explained what salmon DNA actually does and why your expectations may have needed adjusting, please like and subscribe. We will keep translating regenerative science into sentences that make sense. Dr. Lazuk would personally invite you to do so, but she is currently in Seoul correcting the vocabulary of an entire symposium panel and has asked not to be interrupted unless it involves tissue quality or a direct flight home. May your skin always glow as brightly as your smile.